Okay, hello everyone. Vaping has affected many people, including adults and teenagers. According to the Centers for Disease Control and Prevention, e-cigarettes and vaping use can cause long-lasting lung inflammation and increase the risk of chronic respiratory problems, even after quitting. Once prompted as a safer alternative is smoking, vaping has been extremely popular, especially among teens and young adults. But the truth is, vaping is not harmless, and its effects can outlive its habit itself. Now, let's explore how vaping affects our bodies and what happens when we quit. We will begin on the short-term effects of vaping. When someone starts vaping, the body experiences several immediate effects. Respiratory irritation is common, leading to coughing, wheezing, and sore throats. Nicotine in e-cigarettes can also cause dependence, which may result in withdrawals, symptoms like irritability, headaches, and trouble concentrating due to vaping. The silver lining is that most of these acute symptoms are reversible. Once vaping stops, the irritation in the lungs and throat often improve within days to weeks, and then it can improve to years. Now, let's talk about the long term of vaping effects. We'll first begin on talking about the lung health. Long-term vaping can damage lung tissue and reduce lung function. Chronic airway inflammation may develop, potentially leading to early COPD-like chances. Some users may experience lasting reduction in lung, and it can also cause for physical activity. It can make it harder for you to do physical activity. Next, we will begin talking about the cardiovascular system. Vaping also impacts the heart and blood vessels. Long-term use can lead to stiffness in blood vessels, irregular heart rates, and changes in blood pressure. These changes increase the risk of serious cardiovascular issues over time. And next, we will begin on talking the brain and neurological effects. The brain is not spared in this situation. Nicotine exposure, especially in teens, can lead to lasting changes in attention, mood, and impulse control. It also rewires the brain addiction pathways, making it harder to quit and increase long-term dependency rates. So this slide just talks about how it can affect the brain. It can affect the brain through addiction, and the eyes it can affect through irritation. It can make things blurry because of vaping. And the mouth and airways, it can cause irritation, coughing, and blocking airways. In your heart, it can increase chest pain, and it can increase blood pressure. And for your stomach, it can cause nausea and vomiting, and it can also cause pain. Okay, so the recovery of vaping. So for about the first 20 minutes when you quit, your heart rate goes back to normal. And after a few days, you can return to healthy levels. And then about 2 to 9 weeks, the lungs and the function of your lungs can also improve. And then about 1 to 2 months, which is a year, it can actually go back to normal depending how long you were vaping for and how much you used it. And then about a time, through 1 to 2 years, the heart attack rate can be reduced, and it just goes back to normal, and the chances of you getting more diseases from vaping just reduces the longer you stop and wait. All right, any questions?
Why is it particularly risky for teenagers compared to adults?
So for teenagers, their brain is still developing and it can cause more damage for them because once they start vaping, they don't want to stop because they constantly get addicted to it. And of course, their brain is still growing and they need to work on themselves and not vape because it can cause them to be addicted to it throughout their whole life. Any other questions?
Yes. Why do people continue vaping despite knowing the risks?
So many people vape for 3 reasons. It's either for the flavor, the buzz, or just because they think it's cool. Nobody actually wants to hurt their body because of these situations. So once you know those risks, it will reduce the chances of you wanting to do that because it's actually not cool at all. You're just hurting your body. Okay, any other questions? Okay, in conclusion, vaping may end with the last puff, but its effect can linger longer after. This so-called safer habit comes with risks and outlines the user. By choosing to avoid vaping, we give our lungs, heart, and brain the chance to heal and allow ourselves to breathe fresh air and live a long and healthy life. I hope you enjoy watching and listening.